So cutaneous T-cell lymphoma is a rare type of lymphoma that appears on the skin. So some patients just present with patches of scaly or red skin or itchy areas that often looks like eczema or psoriasis or some much more common benign skin conditions. And some of these patients see their dermatologist. They may or may not have had a biopsy, and many of them get treated with topical or skin-directed therapy, whether that's creams or lotions or ointments or things like phototherapy, like light therapy. Most of those patients, fortunately, have a normal life expectancy, but they still do suffer from issues of quality of life. In our clinic, we end up seeing some of the patients who have a higher burden of skin lymphoma, whether they have tumors or they have a higher level of their body involved with CTCL. Some of those patients have plaques, so raised areas on the skin. Some of them, such areas will have ulcerations or breakage or skin breakdown or bleeding or fissures on their hands and their feet, which can be very uncomfortable. Some patients will end up having disease in their blood or lymph nodes or even other organs. And those patients often need more significant treatment, whether that be in the form of pill medicines or IV treatments, and then sometimes even are considered for things like stem cell transplant. So the range of patients with skin lymphomas varies very widely, and their prognosis also is highly variable. So patients who have early stage disease, we believe, have a normal life expectancy, no different than their friends and neighbors. But patients who have more advanced disease can pass away prematurely. The diagnosis of this disease can be really challenging, because it's rare. Most dermatologists or primary care physicians haven't encountered this disease or not frequently, and it shows up differently in different people. So there are some people for whom they have just patches of disease on their skin that looks like eczema or psoriasis, but then there's people who are literally red from head to toe and scaling. They look like they have a permanent sunburn on their whole body. And some patients have tumors, and some patients have flat areas, some people have raised areas. And so it looks different in different people. And in particular, it also looks different in people with different skin tones. So we've noticed patients who have Caucasian skin or fairer skin tend to present with red areas, whereas patients who have higher pigmented skin, like some of our African American or Black patients, tend to present with lighter areas. So it can make it challenging to visually diagnose the disease. Additionally, the skin lymphoma cells make up a very small part of the skin biopsy. They have an unusual appearance, but sometimes it's really subtle to be able to tell on a skin biopsy. So the average patient goes to 2 or 3 biopsies. 5 or 10 years ago, we used to actually quote patients that it could take up to 5 or 7 biopsies to make a diagnosis, because that was, and some of our newer technology using things like genetic sequencing to look for something called the T-cell receptor sequence has made it our yield a little bit better with biopsies. So it's taking a little bit less, but it's still taking more than one for most patients. And because doctors will think that this is a more common disease before it's a more rare disease, which is normal, in medical decision making, oftentimes patients are thought to have what we call atopic dermatitis or psoriasis or eczema or something else or an infection before they're diagnosed with cutaneous T-cell lymphoma. It's not usually the first thing that comes to mind. So it can take years to make a diagnosis. Some of the epidemiologic studies suggest it takes 7 years. The average patient, by the time they're diagnosed, might have even had it for 7 years. And so it can be incredibly challenging. And so, when there's suspicion, we usually recommend that the pathology or the skin biopsies go to a reference center. There are multiple commercial reference centers or academic centers to have them reviewed, because sometimes they'll use like that other technology to help make and confirm the diagnosis. And hopefully that process will get better and better as it has.